TOS be treated without surgery, and what are the best options? So in the medical literature for many years now, it's been stated that about 10% of patients with TOS go to surgery. I'm not so sure that those numbers hold up. What I can say is that the dogma in general, even among surgeons, is if you have TOS, you should undergo conservative therapy, like physical therapy, for 6 to 12 months before you get to surgery. Now, there are other papers out recently that show that patients do better if there's a shorter time between diagnosis and surgical treatment. Right? So we want to find the patients who do need to go to surgery and treat them faster and not stall them with 6 to 12 months of conservative therapy. But we want to find the patients who don't need surgery, and there are a lot of them, who need to get the right therapy beforehand, and we need to stick to that for a proper amount of time to allow them to get better. So one of the mainstays of this is physical therapy, briefly mentioned. And we know several people who are specialized in TOS physical therapy. This is important. Just like you wouldn't see a specialist who doesn't know about TOS as a doctor, you want to find a TOS specialist doctor. The same thing goes for physical therapists. They're like people who have experience and a good track record and have a dedicated plan. It usually does not include strengthening in the beginning. It includes things you may have seen on our videos with Steve Talakowski: relaxation, biofeedback, changing posture, improving breathing. But rest is an important part of it to allow the nervous system to calm down, including the central nervous system, the brain, to start perceiving pain in a different way. So physical therapy is a big part of it. Then what I roughly call occupational therapy. If you have a non-ergonomic workstation, or you have a job that requires you to work with your arm in an unusual position or your neck in unusual positions, we want to correct those things, give you the best tools, and correct the bad motions. Third, some people use drugs, standard pain medications, up to and including opioids in many cases for severe pain. There are nerve agents that calm the nerve membrane, nerve stabilizing membranes, such as gabapentin you may have heard of. So there are a few categories of medications that can help.